Total hip replacement, as it was developed, it was more commonly done through a posterior approach. Developed simultaneously in the history of total hips has been a direct anterior approach to the hip, one that just separates the muscles without splitting it. We do put the component of the hip socket in better. There's proof that there's less dislocations. A lot of patients that have a posterior approach are told not to do certain things and to have precautions with their hip motion. The benefits of the anterior approach are the quicker recovery, which I see in my patients, the decreased dislocation rate, and therefore no limitations on motion of the hip after surgery. Because of the way that we put it in, because we don't violate the posterior soft tissues, which is the main direction of dislocation, we don't limit their motion and/or any of their activities. I think the benefit of having a hip replacement done at Northwestern is that we have a unified program with regards to hip replacements. So we have very specific means of pain control, very specific protocols for rehabilitation, very specific protocols for care of the patients on the floor. So when you have your total hip done at Northwestern, you know that you'll be through a protocol that's been well established at this institution that will decrease your risk of complications following surgery.